Hello, Dr. James Bogash, expert in health and longevity, and today we're going to talk about a topic that has really been the past, I don't know, 5, 6, 7, 8 years. Intermittent fasting, time restricted eating. You never heard those terms 20 years ago, even though calorie restriction without nutrient restriction has always been shown to help with a lot of different conditions. And so it's gained a lot of popularity over the years. There's a lot of misconceptions. There's a lot of things that are done wrong with that, but there's a lot of potential to do right with time-restricted eating, intermittent fasting. The reality is that we eat way too many calories in this country, and anything we can do to cut back on them is important. So if we're cutting out a meal a day, that's, depending upon your breakfast, anywhere from 200, 300, 400, 1,000 calories a day less. And the benefits from that may have more to do with just straight up calorie restriction. The nice thing is that time restricted eating can be a very amenable way for people to cut back on calories rather than overall calorie restriction. So I'm going to give a couple tips on time restricted eating that will help make it more effective. But first I want to go over the study looking at time restricted eating. These were people who had obesity or prediabetes, metabolic syndrome, and they followed them for 12 weeks. And so basically they ate between 8 a.m. and 6 p.m. One group ate 80% of their calories before 1 p.m., so that's time restricted eating. The other group ate throughout the day more evenly. They were all the same prepared meals, so same basic calorie. And there really wasn't a whole lot of difference, boiling back down to the fact that it's more about the calorie restriction. And there were 41 people in the study, so not terribly large, but big. Half usual eating, half 21 who did the time restricted eating. The average weight loss was 5 pounds in the time restricted eating versus 5.7 in the usual pattern. In the scheme of things, not really a big difference over the course of 3 months. But they were effective. There was weight loss with that. Again, time restricted eating is not a hard pattern to follow, but here's some tips. And I'll give you another one that's not really a tip, but something that I'll use when I do time restricted eating. First one is that it is very clear that eating earlier and stopping earlier is better for us. No doubt. It has everything to do with the lymphatics, the way we clear out our brain at night. You always hear you're not supposed to eat before bed. Well, that's why. And in this study, you even saw that it was 8 to 6 p.m. But when they look at a lot of other markers, things get better when we stop earlier. So if you can stop eating for the day at 1, it's way better than stopping at 8 o'clock. And in a minute, I'll describe what I do and why that doesn't necessarily work in my lifestyle. So eating breakfast, skipping dinner, or having a very early dinner. Number 1 tip. Number 2, I see this all the time. I'll have patients that tell me that they do intermittent fasting, and I'll ask, well, what's your first meal of the day? And they'll say, oh, well, I first eating, I remember a patient was around my age, diabetic. It was about noon, I think, and so started working on her and asked her like what she has for breakfast, because that's a pretty critical question, almost always the first question I ask out of the gate. And she said that she really does intermittent fasting, and so I asked her, like, what does it look like for you? Because there's a lot of different flavors. She said, I really don't have my first meal until about 1 or 2 o'clock. I'm like, what's in the Dunkin' Donuts cup? Well, clearly she was having a 400-calorie mocha for breakfast. I see the same thing with patients who say they do intermittent fasting. They have their first meal around lunchtime, but then I ask them if they have what they have to drink, and they may be having something like coffee with creamer. What they're having is creamer for breakfast. That is not intermittent fasting. You're breaking that fast with the creamer. So it's critical to pay attention to what you might be drinking and what you might be putting in that drink. I was going to go somewhere with that, but the third tip then is, if you choose to, for me, in our in my lifestyle, usually I may go to the dojo at 6 o'clock, 6:30 at night, don't get home till 8 o'clock, have dinner. So it's easier for me to skip breakfast and have dinner. In that case, the thing we don't want to do is trigger an insulin response. It's part of the benefits of time-restricted eating or fasting is that when insulin goes up, it changes everything. We want it timed out. We want some glucagon exposure. And so I will do usually like if I'm running late or if it's a Saturday, I'll describe that in a second. But I'll do like we'll do our own home cold brew coffee and put some heavy cream. I prefer like coconut cream, something that has fat but no calories. I do cold, so things like ghee or coconut oil don't work. But you can do that to help curb your hunger. If you do time-restricted eating or fasting too much, you run the risk of losing muscle mass. We can protect against that loss by not triggering hunger. So I will have that cold brew mix to sip on during, before I start eating to curb my hunger and hopefully preserve more muscle mass. The other thing I will do, generally Saturdays I go to the dojo, I'll do kickboxing, judo, jiu-jitsu, and I'll have my first meal at, 1 o'clock or so. There's something called the Bahadori leanness principle where you can, mainly from a brain protection standpoint, but it makes sense that aerobic activity makes up for not eating. If we're starving and all of a sudden we see prey that we have to go hunt, it wouldn't make sense for our bodies to break down. We wouldn't exist as a species if that was the case. Instead, that aerobic activity may sharpen our mental acuity and will preserve muscle mass. So that is something that I do on Saturday mornings. I'm pretty active those times, and I feel very comfortable not eating and then having my first meal after that. So that really kind of sums everything up and some of the mistakes and some of the tips for time-restricted eating. If there's one other thing I want to add, and if I remember, I'll put it in the description. But other than that, I'll post a link to this study on the time-restricted eating versus usual in the discussion. Make sure you like this video, share it with somebody who you think needs the information, and subscribe to the channel.